The idea of prescribing a little bit of extra assistance at near is not new, and we can call them a reading addition or a near add. Anti-fatigue is a way of helping people understand that near work is not something we're designed to do for a long period of time. We've got I think a little bit of a soapbox of mine. We've got this incredibly sophisticated visual system designed to help us move through a three-dimensional world with two eyes, and we sit still looking at two-dimensional things instead as part of modern life. And so much like other parts of our musculature, our skeletal system fatigues, visual system's no different. So, as I like to talk to patients, that, your eyes are organs, because, the fear is that people worry, oh, do you make the eyes weak by providing some assistance? And it's like, well, fatigue is overwork. Organs work all the time. Eyes are organs, and it's overuse that creates the problem. And, it's a bit of an individual difference based on the way you go about doing your near work, how much intensity do you use, the sort of the tasks. But generally, if you spend a long time doing near work, you do start to get eye strain symptoms. And I've forgotten the exact numbers in the research, but we're talking the majority of people, if they do, a reasonable bit of device use or computer work, get some sort of eye strain. And so it's a modern twist on a modern problem. Back before devices and computers, it was the people who read a lot who tended to get eye strain. And I only had a gentleman in the other day who, he was a tradesman, and he's now, got a promotion. He's a supervisor and he's a manager now, and he's in the office and he's getting eye strain, because his the way he works has changed. And so the idea of an anti-fatigue lens is that they show that with fatigue and eye strain, you start to get fluctuations in your focusing. And that's linked with what we loosely call, which is a group of symptoms called asthenopia, which can be headaches, eye strain, loss of concentration, those sorts of things. And the idea of an anti-fatigue is it's a way of providing you with some relief, take away a little bit of the effort up close. I like to call them an ergonomic device, much like having an ergonomic chair or an ergonomic keyboard to keep you in good posture and keep you comfortable. And the specifics about an anti-fatigue is it allows you then to be able to see across the room while you're wearing it. So it provides that support at near on your device or your iPad, and then still be able to see whether you've got a prescription, whether you need a prescription or not. Now, further, you use whatever you normally use to see clearly further away.
And I think there is a fair degree of confusion out there when it comes to anti-fatigue glasses. People talk about they need blue light glasses, okay? As in, we can talk about that, like lenses that cut out particular type of light, blue light. And so anti-fatigue glasses are not exactly that, are they? So there are some important differences there.
Absolutely. And an anti-fatigue lens is not just something you throw on too. And it is something that's prescribed and carefully thought about based on the results of your vision exam. And it is actually a prescription that we add into your lens when we make it. So it's a custom, individualized approach. And then you've got lots of different coatings. So you've got plastic lenses have a soft surface, so they're easier to scratch than glass. You don't want to wear glass anymore because they break and they're heavy. So it's even harder. It's even hard to prescribe glass now. A lot of the labs just don't even supply it. So we have this plastic with a hard coating. So think of it a bit like your baked on 2-pack paint that they put on cars. It's quite tough, but it can still scratch, but it's still better than the underlying plastic that the lens is made from. And then, so hard coat's a fairly simple layer to reduce scratching. And then you get a thing called a multi-coat, which is also called an anti-reflection coating. And they're actually quite sophisticated. They're very, very small, thin layers, and usually anywhere between 7 and 9 layers to create this effect where you're getting a hard coating, but it also reduces the amount of reflections of that white light off the front of the lens. And a version of that is also, you can add in a filter for blue light. And so there's been a lot of noise made around the dangers of blue light for long-term eye health. And there's evidence that blue light interrupts sleep patterns. And so there is a place for blue coatings, but I think some of it is a little exaggerated. There are many people who don't actually like the blue coating when you put it on their lenses. So we're always careful to show people the difference. And some people absolutely love it. They like that little bit of yellowing. They find it comfortable because they might have a bit light sensitivity. But that's very different again to the sort of fatigue that you get, which is your accommodation muscles, your ciliary muscles getting tired over time while you do near work.
So could you get a blue light filter added to your anti-fatigue lenses? So it's
Yes.
not like it's not a mutually exclusive thing.
No, no. So you can have an anti-fatigue with a hard coat, with an anti-reflection coating, with tints, etc. And likewise, you can put a blue coat on any optical
Right.
lens.
Yeah. And I've heard some people talk about computer glasses as well. So I don't know if they are like an actual unique type of lens that's designed for looking at screens an arm's length away, or whether again people are confusing computer glasses with anti-fatigue glasses
Or away from the blue light again, because
or blue light.
a lot of people buy blue light glasses for using the screen and using the computer. So there is a lens that there are lots of different labels out there, and a lot of it's just to try and convey. I'm sure some of it's marketing, of course, but a lot of it's to try and convey what they've done. So if you are advancing in years, like a few people that are close to home right now,
Yeah, nobody I know.
maybe even being interviewed on YouTube here, you start to lose your near vision, and it becomes less and less flexible over time. And
Yeah.
so, you might have a pair of reading glasses that are suitable for both your reading distance here and have no problem with the computer screen. But as your flexibility deteriorates further, those lenses for reading, become a lot less flexible in terms of their range, that they're now here, but you can't use them for the computer screen. So we have to use, you can call them an enhanced reading lens or an extended focus lens. Loosely, they're called occupational lenses because they're typically the type of lens I like to call them an office lens, because typically what it does is it puts in the upper half of the lens, around that sort of 60 to 80 centimeters away, and provides a nice big broad area for you to be able to look at your screen and your desk. And then it'll have an additional bit of reading power down the bottom for things that are closer, like your keyboard, your phones, bookwork, those sorts of things. And so there's a whole different variety of those extended focused or office style lenses that are available. And they have a good place, because when people start wearing progressive lenses, sometimes that middle zone that we might want to use for computers is a little small and restricted.
Right.
And so, if you do a lot of computer work, sometimes you just need to get something specifically for it. It's a bit like putting a pair of work boots on when you go to work. Work boots are there for a reason. You can't wear sneakers at work, and
Yep.
vice versa. So,
Yeah. That's a good analogy.